In this section, we're going to talk about the uterus and the vagina. So the uterus has three tunics, three layers in the wall. The outer layer that goes around the uterus is called the perimetrium. Metrium is this suffix that means uterus. So we got the perimetrium, and then the next layer is the myometrium. Myo, you remember, means muscle. So this is the thick muscular layer. This is actually three layers of muscle intertwined, much like the detrusor muscle in the urinary bladder. And this layer gets much, much thicker during pregnancy, so that when it's time to give birth and push the parasite, I know, okay, it's not a parasite, but it acts like a parasite in the mother, even though it's the same species, so it's not a parasite. When it's time to give birth, the myometrium can contract very efficiently and very strongly to push the fetus out so that it can become a baby. The endometrium is the innermost layer that faces the lumen of the uterus, and it's actually made up of two layers. The basal layer is permanent, lots and lots of blood vessels going through there, and it's attached to the myometrium. The functional layer is the layer that is most important to those of us who have a uterus. This is the layer that gets thicker during the menstrual cycle and then is shed during menstruation. And in the later section, when I talk about the menstrual cycle, we'll talk about exactly how this thickening happens and how we'll watch the pattern of thickening and thinning. So the three layers: perimetrium on the outside, myometrium is the thick layer that gets thicker during pregnancy, and endometrium is the layer that gets thicker during the menstrual cycle and then is shed if there's no pregnancy at the end of the menstrual cycle. Now, we already talked about the cervix, which is this opening, the neck of the uterus. And the most important part of the cervix is this dome-shaped portion that extends into the vagina. There are lots of mucus secreting cells here that make a mucus plug that blocks the cervix and prevents materials from the outside getting into the uterus. So now you're wondering, hang on, how does anyone get pregnant? Well, that mucus plug gets shed right around ovulation. And most women will notice a thicker vaginal secretion, and sometimes like they'll see a white pile almost, and that is the cervical plug or the mucus plug being shed. And that's a perfectly normal thing. That indicates that ovulation is about to happen. So at the time when fertilization should happen, that cervical plug is not there to prevent it. Also, it's not thick enough to prevent sperm from swimming through. Now, during a Pap smear, a doctor takes a speculum, which is, it kind of looks like a modern torture device. It kind of is. And it is a device that can be cranked open. It is inserted into the vagina and then opened so that the doctor can visually inspect the cervix. So they're looking at this dome-shaped cervix and the walls of the vagina. And they're looking for even tissue. This is just a stratified squamous epithelium. Then they take this special medical brush and scrape cells from the surface of the cervix. That's called a Pap smear, and that is used to detect possible cervical cancer or any abnormal cells that could develop into cervical cancer. So normal epithelial cells, they're just squamous cells. This is what squamous cells look like from the top. In the case of an abnormal Pap smear, what happens is we see abnormal development of cells. We have these dysplastic means, dys means not or abnormal, and plastic means form. So abnormal cells, often with multiple nuclei, and you can see they just don't look as even. The nuclei are bigger. That's what we see in an abnormal Pap smear. This can sometimes develop into cervical cancer. More often, it doesn't. And if a woman has an abnormal Pap smear, Her doctor will usually say, come back in a few months and we'll redo it. She then freaks out thinking, oh my God, I have cancer. But then she goes back in a few months. She has another Pap smear. It comes back normal, and the doctor says, great, everything is fine. And she wonders, what happened? Was there nothing abnormal? Like what happened with that first one? Well, what happened is that the body's immune system was working the way it's supposed to be. The immune system recognizes not only foreign materials, but also abnormal self cells. So cells in the body that are not normal, that have developed abnormally. And the macrophages, which are constantly monitoring our tissues, will engulf cells like this and break them down. That's a normal part of our immune system keeping us healthy. So if a woman has an abnormal Pap smear and then she has a normal Pap smear, then that's a sign that the immune system was working properly. There were abnormal cells there. They've been broken down, and everything is fine. It does not mean that a woman is more likely to develop cervical cancer later in her life. That doesn't stop insurance companies from punishing women for having an abnormal Pap smear. So before the Affordable Care Act, insurance companies were able to either deny coverage to someone who had a pre-existing condition or charge them more for it. And an abnormal Pap smear was considered a pre-existing condition, even if it had been 20 years since you'd had an abnormal Pap smear. If it was in your records, they could charge you more for it, for insurance, or refuse to give you insurance at all. That was a very, very real thing that caused a lot of problems for a lot of Americans. That was one of the things that the Affordable Care Act was meant to fix. And so when people talk about protecting coverage for pre-existing conditions, that's one of the things they're talking about. Republicans have been trying to kill the Affordable Care Act since it was created because, it's also called Obamacare. And they hate Obama. But anyway, that's why we want to maintain the Affordable Care Act. Moving on. The vagina itself, as I said, is a muscular tube. In addition to being the site of reproductive sex, that is, sex that may or may not lead to reproduction, it is also the birth canal. And it can stretch a lot. It doesn't stretch out and never come back into the original shape. Okay, it can stretch and then just, reform into its original shape. It might take a little while because birth makes it stretch a lot. But no, a woman does not develop a flabby vagina, which is something that men actually believe. So anyway, that's the uterus and the vagina. Remember the 3 layers of the uterus: the perimetrium, the myometrium, the endometrium. The cervix is the opening, and then the vagina is this tube that connects the uterus to the outside environment.